Hello, this is Dr. Joe. Today we are going to talk about osteoporosis. As you all know, this problem is so common, it is hard to believe. It is fairly easy to prevent it if you know the principles. We have so much excess food in modern days, but people have this problem more and more, which means this excess food doesn't really work well for your bones. Usually people notice their low bone density after a bone density scan like a DEXA scan at the hospital. If the figures are low enough, a diagnosis of osteoporosis is given and medication is prescribed. Calcium is also recommended with the daily intake of about 1500 milligram. The reason for testing for osteoporosis for people, especially elderly population, is that elderly individuals have a higher mortality rate if they have a bad fall. If they get fracture often in the femur head, the hip bone region, this is one of the most common fatal injuries in the elderly population, still even in modern day. The problem is that this DEXA scan test, while considered the gold standard for diagnosing bone density, is not accurate enough, but also calcium supplements and medication have their own problems as well. They are inefficient due to the nature of the mineral metabolism in our bodies. We need to see bigger pictures. The expected effects of osteoporosis medication is to improve bone density, which is about 2% a year, which is minuscule number compared to detox and exercise, and also this effect doesn't last long enough. So a diagnosis and medication alone are not enough for sure. There is no single study showing that patients who take the medication have a higher survival rate from the fall compared to those who do not. Biggest problem is that neither the patients nor the doctor looking for underlying causes, which is strange. It seems like willful blindness. Bones are not static structures like limestone statues. They're living tissues that constantly break down and repair, just like your skin and muscle tissues. Osteoporosis medication artificially increases bone density, but having high bone density does not mean the bones are healthy. Underlying problems still persist, and the efficacy of the medicine does not last either. Bones that have lost their normal metabolic capability cannot be healthy, even if bone density increases through medication. If patients have a bad fall and get a fracture, recovery is still very difficult. Simply taking medication and calcium, because test results indicate low bone density, is akin to hoping for the best from the sky. The cause of osteoporosis are various and can include lack of exercise, hormonal changes, and insufficient vitamin D synthesis, which could be most common in modern life. Osteoporosis may also be caused by toxic effects from heavy metal exposure. Cadmium is particularly problematic as it accumulates in bones and the bone matrix is unable to metabolize normally, which will definitely affect the bone density. Fundamentally, heavy metals compete within our bodies, potentially leading to a deficiency of essential minerals for bone health. This factor must be considered. Our bodies require more than 100 different minerals, including zinc. When cadmium competes with zinc for its place in the bones, it leads to conditions like osteomalacia, osteopenia, and osteoporosis. Cadmium weakens the structure of the bones, and prescription calcium can worsen the condition because calcium pushes out zinc in the bone matrix, and the accumulated cadmium further deteriorates the state of osteoporosis patients. So calcium is rarely prescribed to osteoporosis patients in the functional medicine realm. Other forms of the calcium, such as nanocalcium, are simply ineffective. They are just an expensive version of the regular calcium. Zinc plays an important role in bone matrix. Zinc deficiency can cause sudden weight loss, slow wound healing, and symptoms like memory decline. Patient may also be decreased sense of smell and taste, leading to excessive salt in food. So if your mother gives you very salty food, you may want to check her blood zinc level through a simple blood test. As people know well, zinc is important for the strong immunity, especially for diabetic patients. Glycosylated hemoglobin is a combined form of sugar and blood cell, which is an important indicator for bone health and various systemic problems. Blood tests can confirm zinc deficiency, and environmental factors are also important. such as those found in wallpaper, lining of the wires, pipes in the house, and even in cement. Osteoporosis patients should pay attention to the underlying causes to prevent worsening condition and to recover to normal bone density level. The most effective way to prevent and manage osteoporosis are strength training and reducing carbohydrate intake. All of us know life is hard, but we cannot bend around the reality. If we understand how reality works and apply that knowledge properly, life will bring us comfort. If not, it will present us with problems. If you find this podcast helpful, please share it with those who might need it. Thanks for listening. It's been Dr. Joe.